Okay, guys. So we're looking at the Pentagastrin Secretion Test, or some people call it Stimulation Test, right? So it's more of like a basal and maximal acid output, trying to access for that. Alright, so let's look at it. So that the Pentagastrin Secretion Test is used to measure gastric acid secretion and also access for what? How your parietal cells, okay, these are the parietal cells in the stomach, are functioning. Alright. So the procedure now is that the test involves what? The patient to fast overnight, alright, then followed by what? Insertion of a nasogastric tube to collect gastric juice from the patient. Alright. So the basal output is measured first. Alright. That's like you didn't eat, but how much of your gastric juice is still being secreted. You measure that. Then you now administer what pentagastrin, which is like a synthetic form of gastrin, right? So that to stimulate acid production, right? Then the maximal acid output is now measured later. Do you understand the procedure? So measurement now, gastric juice is collected at regular intervals and analyzed for volume, pH, and acid content. Now, the basal acid output is the amount of acid secreted before the stimulation, while maximal output is after the stimulation. Right? You stimulate the individual gastrin with a pentagastrin, which is synthetic form of gastrin, right? So interpretation now, normal value should be about 1 to 5 millimoles of HCl produced per hour for the maximal acid output. Then, okay, I think this is a range. Okay, so at least, okay, sorry. Okay, typically, okay, per hour, they are, well, I don't really know why they brought this range. Alright, but we have the first range, so I think let's work with it. So values outside of this range indicates that what? There's too much production of all those gastric juice, right? So that's Zollinger-Ellison syndrome or gastritis, right? So we have a summary here. So that after an overnight fast, gastric secretions are collected by nasogastric tubes and the basal secretion. So a gastrin derivative, that's pentagastrin, comprising of 5-carboxythermal amino acids of gastrin is injected. Now the secretions are collected for what? A further period to measure maximal acid output. That's after the stimulation. So HCl secretion is determined by a back titration with sodium hydroxide to a pH of 7.4. So the test is used in what? Conditions of acid over excretion to confirm under excretion. You understand? So it's mostly used in patients with duodenal ulcers before surgery, just to access for residual vagal inhibition, okay, after vagotomy too. Alright. So indications, it can be used in checking out for peptic ulcer disease, megaloblastic anemia, vagotomy, aclohydria, and all of that. Okay, so I think this is beautiful.